you can just wake up one day and say that I'm depressed just because I feel guilty about my past. You can't wake up one day and say I'm depressed because I'm feeling sad or I'm feeling low, or I don't have the mood to go play games, I don't have the mood to go out. So good morning, good afternoon, good evening to whatever time you'll be watching this. Welcome to my YouTube channel. In case you're new here and it's your very first time, I'm Rose. I'm a student of psychology at the University of Nairobi, and I'm also a business person. Yes. And in case you're returning subscriber, thank you guys for your continued support, and thank you for always being there throughout this journey. And talking about journey, yes, in case you're new here, this series is about journeying with you as an individual. It's for you as a student of psychology. Maybe it's for you as a normal individual who wants to actually understand what mental health really entails. And also it's a platform where we get a chance to vent, where we talk about different issues we've gone through in our lives. And basically, from the name, is about journeying. And I know this will be a very good series where we journey with each other throughout our lives and get to know each other and get to know what really mental health is and how we can live normally as individuals. So on my second episode, so this episode is amazing. I know you've already seen from the description below, you've seen what we are talking about. Today we'll be talking about depression and what really depression is, signs and symptoms of depression, and is it depression really treatable, and who is likely to have depression, and yeah, just about depression. So on to what depression really is. Depression is a mood disorder, meaning like it affects our mood, how we do things, how we feel, how we actually how our energy towards activities, how you used to do things, how you're doing things right now. I think it's just more of the mood. You know, those moments where you say like, I feel like my mood is low, I feel like I don't have energy to do this, I don't have enough psych to do this. So when we talk about mood, that's what exactly we mean. So it's a mood disorder, and mostly it's a sudden feeling of lawlessness, sadness, anger, loss, or feeling like you have not enough energy to do the things you used to do before. You understand? It's more of like it's a sudden lose of energy, like sudden lose of your morale, your psyche. It's just how you go to the far end where you feel like you don't want to do things the way you used to do them, and your energy is diverted to other things, not positive things in most cases. So who is likely to get this depression? We say like anyone can get depression, and sometimes we even get depressed and you're not able to tell like sorry. And sometimes we get depressed and we're not even able to tell like if actually we're depressed. And I was having a question on Instagram. I was asking people like, okay, I asked people so that I can know what exactly people want to know about depression, and somebody asked a very nice question like, is it possible for you to be suffering from depression, or maybe to have depression and actually not know you have depression? And yes, it's possible for you not to know, because sometimes we are closed, we close depression to so many things, like since it's a sudden change of mood, sometimes we confuse it to laziness, we confuse it to stress, we confuse it to anxiety or other psychiatric disorders, because we do not know what depression actually entails. And sometimes people can actually not tell when you're depressed because they just feel like you just don't have the morale, you don't have the psyche, you don't have the energy to do what you want to do. And sometimes it's confused with sometimes it's confused with so many things, and we're not even able to actually tell if we are depressed. So how is it possible for me to know that I'm depressed, or how is it possible for me to tell somebody else is depressed? So we have the signs and symptoms of depression, where they're divided into three categories, where we talk about feelings, behavior, and thoughts. Like how has your feelings changed? How has your thoughts changed? How has actually your thoughts been different from how you used to think? In terms of feelings, we have feelings of sadness, we have feelings of anger, guilt, and hopelessness. So since depression is more of mood, we realize that our feelings totally change towards things that we used to love. Sometimes you used to love music, now you don't find any energy. Sometimes you maybe used to love music and you really needed, like it was your day in, routine, you understand? But now you do not have the same energy to do the same things that you used to do, and you feel so sad about it. You feel like so angry, you feel like so angry. And sometimes if we are the cause of the problems probably in our lives, we kind of feel guilty about our situation. Another symptom category is behavior. How our behavior totally changes. We like seclude ourselves from the social world. Like we don't want to know what's happening outside there, you understand? And it's very common when people shut down totally, you understand? They don't come out for events like people used to do. They don't come to the school. They don't go to church. They don't want to be seen where people are, you understand? So they totally seclude themselves away from the social gatherings or social activities that they used to do. We call it social withdrawal, where you just want to be alone, you understand? Sometimes people end up sleeping too much and others end up sleeping less. You know, it's just different, like depending with your signs and symptoms or the situation you are, you're likely to have too much of sleep, you're likely to have less of sleep, depending. Yeah. And sometimes people gain weight or lose weight, depending if your depressive symptoms take you to points where you eat a lot or not eat at all. It's either both ends, where you just don't eat the way you used to do, so you're eating a lot or eating less, and that results to either gaining weight or losing your weight. We have like poor concentration. You cannot put your mind together for like 1 hour because you have so many things running in your mind. It happens because if you can't concentrate, likely it's because I have so many things in my mind, or I have too much of things I'm thinking about, or I just can't concentrate totally. Sometimes we don't have anything in our heads, like we're not even thinking at that particular moment, but unapata you cannot concentrate totally. So it happens. So how do our thoughts change when we are depressed? First of all, we have poor self-esteem. Individuals who are depressed are likely not to have the courage to do things the way they used to do. Their esteem totally goes down because they feel low, they feel not motivated, they don't have enough energy, they don't have enough psych. Okay, you realize that the moment you get depressed, in most cases you don't do what you used to do. You withdraw yourself totally from the things that you used to love, and that's where the low self-esteem comes in, because in most cases you're either alone, you're doing your things alone, you don't to gather with the other people, you don't be in the social gatherings at all, and this really affects your self-esteem, because you feel like I'm worthless, I can't do this, I don't need this, people are not there with me. As in, you just feel too much of guilt, too much of worthlessness. You feel like I am nobody totally. Another thing is to have suicidal thoughts, and having suicidal thoughts and attempts of suicide is one thing and the other. And we feel like individuals who've had suicide in the past have had background check about their lives, and they feel worthless. So the moment you feel worthless and you find no reason of living, and that's where we find people trying to attempt suicide and also thinking about suicide. We encourage individuals who've had suicidal thoughts, or in case your family, in case anyone in your family has had attempts of suicide, it's always nice to take them for therapy, take them for counseling, ensure we have enough check on why they're feeling that way or why they attempted the suicide. Enough with the symptoms and signs of depression. And there's also another question I was asked: is it only men or women are likely to have depression? Everyone has equal chances to depression. There's no one who has a higher chance of depression or anyone who has a lower chance of depression. First, we find like women go through depression mostly because of peer pressure, there is pregnancy, there is menstruation, there's the afterbirth, there's hormonal changes in their body, and sometimes also the fact that how life goes may push someone to depression. Men can go through depression because of the peer pressure. They need to make they need to do things the way other men are doing. Another thing is, men can go through depression because they want totally to fit in. There's the pressure of marriage, there's the pressure of having to provide for their families, there's the pressure of having money. So anyone has equal chances of having depression. There's no one who is at a higher chance than the other person. So Don't say you're likely to have depression just because you're a lady, or you're likely to have depression just because you're a man. Anyone has equal chances to having depression. So we're going to talk about types of depression so that you can be able to know what exactly am I suffering from, or what kind of depression am I suffering from as an individual. Postpartum depression is not commonly known, but most people know it, and this is the depression that is that many women have, especially after birth, just few weeks after childbirth, and mostly non-baby blues. They feel like the kid is here, I don't know how to handle this kid, there's too much pressure, I don't know what to do and what not to do. So it happens, and women feel like they have too much pressure, and they get anxious about children crying, they get anxious about being alone with the children, and yeah, so sometimes it happens, and critically happens to those women who have had childbirth and not able to be in a family. For example, maybe you gave birth at the age of probably 19, 20, 25, or even maybe those far end ages, but you're not able to be with your husband or the child to your father for guidance, for support, for maybe they need to cook for you, they need to do all that. So when you feel like you're alone as a mother, and you have to take care of this child alone, probably you've been pushed away from home, your mom was like, no, you can't have a child at my place. Maybe this guy amesema mtoto si wake. You get, like, you find like there's too much getting into yourself that you're not even able to know how to release it, and even not able to know how to handle your children. Okay, so sometimes when the child cries, you feel like they're making noise. When the child cries, you feel like, I can't handle this. Then you have too much pressure going in, and sometimes you call them baby blues because it's just for the few weeks after pregnancy. It persists for like more than 6 weeks. You're supposed to see a doctor, probably because it can be getting into your system and you're not even able to understand and enroll yourself into the normal world as a mother. Another type of depression is dysthymia. Dysthymia is persistent depression disorder that lasts for more than 2 years. So maybe you've had depression before, and most people have had depression before, but they went to a psychiatrist, maybe they went to the hospital, they got treated, but now the problem is the depression is persistently coming almost for more than 2 years. You've been depressed, like, okay, you've had episodes of depression, that's what we call them, like 1 month you are really nice, the next month you're going through depression, after 4 months you're okay, the 5th month you're going through depression. So like it's a persistent depression, like after almost 2 years. So sometimes you find like we go through difficult moments and we are not able to understand them, and we're not able to heal from the past. So that's why depression really comes in episodes, because you don't want to move on from the past, so it becomes really hard even moving forward. And that's why you find yourself again and again and again going through the same systems or the same episodes of depression. Another type of depression is, we call it psychotic depression. Psychotic depression is where you have hallucinations, you have delusions, you see things people don't see, and you hear voices that no one totally can hear. And mostly it's related, or you have other psychotic disorders. For example, you can be depressed and still anxious. You can be depressed and still going through schizophrenia. You can be depressed and still going through bipolar, as in having too many psychotic disorders together, and more like having delusions and hallucinations. You just have these weird voices in your head, and no one can actually hear them, and no one can actually see what you're saying. And sometimes you get so much distracted because you feel like people are running after you and all that. So we have 2 types of medication for depression. We have the ones that you have to go for meds, the other one you don't have to go for meds. The one that you have to go for meds is when you have been diagnosed of depression and you have to be given antidepressants and different medications just to ensure that you remain on the same system. For the one that you don't need meds is mostly what we call therapy. Yes, therapy or counseling, and sometimes talk therapy mostly, because talk therapy is where we one-on-one we have a conversation where we are talking about how have you been feeling, what do you think pushes you to that point of feeling. How do you feel like you can reduce the feelings you've been having? How do you feel like you can activate your moods? So just talk therapy, where we have conversation one-on-one with our patients, where we want to understand them from a different point, or why they feel they are depressed. Yes. And this brings me to the end of our episode today. This is the second episode on our first series. I know you've learned a lot. I know you've gotten a chance to get ideas of different things, and hope you go down in the comment section. Tell me what you've learned about on this episode. Tell me what you think more, and what you'd like us to talk about next. And in case of anything, if you feel like coming on board, let me know. And this is Mental Month, and I hope you guys are taking good care of your mental health. And as much as we push ourselves to actually taking care of our peace and taking care of ourselves, always remember that you as a whole, as a being, you have three components. You have your mind, you have your spirit, and you have your body. You have to align these things in a place where they are all in one common direction for you to become whole. Take good care of yourselves, and always remember that you are better than what everybody else thinks.